friends. I'm Samantha Simpson, and I'm so excited to be with you today. This is The Movement, my show where I chat with other holistic health practitioners about anything from movement to holistic health practices. So today I'm so excited to be interviewing a local Indianapolis person. Her name is Briahnna Roy-Scott, and I'm just going to invite her on. Briahnna owns the business called Heart and Womb Indie, and she's a doula. Hello, it worked. Why don't we start with you sharing with us a little bit about what you do?
Awesome, yeah. So I'm a childbirth doula and a hypnobirthing instructor here in Indy. I also own a doula agency, the only doula agency here in Indianapolis right now. And I guess the only childbirth and postpartum doula focused agency. And yeah, I've been doing this for about 2.5 years now, and I love every minute of it. I'm beginning midwifery school at the end of this month. So I'm excited to move forward even deeper into the birth sphere as a midwife. But yeah, it's definitely my passion.
Awesome. For people who don't know, can you share with us a little bit about what is the difference between a doula and a midwife?
Awesome. Yeah. So a lot of people get that confused. They hear doula and they think that you're catching babies, but a doula is there purely as an emotional and physical support, whereas a midwife is there in more of a clinical role. They're the ones who take your blood pressure. They're the ones who give you, guidance as far as like medications or prenatal care. They're the ones who are going to be listening to baby's heart tones, all of that. As a doula, you are there to do physical support during labor. So we do comfort measures like counter pressure and massage techniques. We help the client prepare for their birth in the prenatal sphere as well, giving them education, information on their options, teaching them how to advocate for themselves. It's all around support. We're there emotionally for them throughout the entire journey as well, and not just there for the birthing parent, but also the partner, especially with the first-time parents. If it's the partner or the dad's first time seeing a birth, they definitely need support too, because a lot of times they're just expected to know exactly how to help their partner and what to say and what to do. So having a doula there also takes some of the pressure off of the partner.
That's awesome. Thank you so much for your work. It sounds like it's totally needed, especially nowadays. One of the things that attracted me to your profile on Instagram, and I think that's how I found you, is that you are speaking a lot against the current birthing system, the hospitalized birthing system. And you seemed very impassioned about that. Can you share a little bit about your perspective on that?
Yeah, definitely. I mean, the medical system when it comes to birth is needed, right? There's always going to be outliers when it comes to birth. And so I don't want to say it's unnecessary, but we lean very far in the pendulum swing of, holistic and medicalized births. And we lean very far to the medicalized birth system. And it does a lot of damage to birthing families. We're seeing some of the worst outcomes we have ever seen in our current birthing system that we have. About 92% of people giving birth today are being attended by obstetricians and gynecologists. And we're seeing the effects of that because OBs are trained surgeons. And they're very good at what they do, but they are trained to cut. They are not trained in the natural physiological process of birth. They are trained to intervene. They are trained to handle high-risk pregnancies, and they're very good at that. But the average pregnancy is not a high-risk pregnancy. And so when we funnel low-risk, healthy parents and babies through the obstetrical model, we see the outcomes that we're seeing today, which is an average of 33.3% cesarean rate, which is 1/3 of all people who walk through the hospital doors will walk out with a cesarean. We're seeing that 1/3 of all women giving birth report being traumatized. And so we are not seeing good outcomes despite pushing the very medicalized version of birth.
One of the reasons this affects me a lot is because I work with a lot of moms. I work with a lot of women who have gone through this trauma of birth Either they've had a cesarean section and they've got so much scar tissue now that it's limited their movement, or they've had a vaginal birth that was traumatic in a way, lying on their back, their pelvic floor is blown as a result, and they're having to come to me to help. Like, Samantha, I've got pelvic floor issues, or I've got issues in my core, and I know it was because of this. And it's like, it sounds like that's the norm right now. I've been doing a little bit of research lately, and it seems that around a few hundred years ago, birth was medicalized, and it went from women helping women to men helping women give birth.
Yeah.
And that giving birth on a table on their backs was the most convenient way. What is your perspective on the posture that facilitates the healthiest birth? Is it on the back?
Definitely, in most cases, no. I will say, as a doula, I never say that giving birth is the worst position, because for some births, it might be the best position for you. Depending on baby's positioning, I've seen laying flat on your back for birth to help a posterior baby get under the pubic bone and be born. But when we are doing anything as a rule across the board for every single person, we're going to see effects of that. Giving birth on your back is working against gravity, so it's way harder on your pelvic floor. A lot of times it requires pushing, and also it makes you more likely to tear. Giving birth on your back is largely accompanied by forced and coached pushing, which is also horrible for your pelvic floor and just for pushing in general, because once again, you are using a forced effort to push and squeeze baby out. We all know that your vagina is something that you can make tighter. So when you think about pushing like as hard as you can, you're actually making your vagina smaller, which is where your baby needs to pass through, which leads to more damage in the pelvic floor. Pushing from your back, flat on your back, like we do now in most typical hospital settings, is actually something that began because there was a king that wanted to watch his babies be born. And so it became from kind of like
wow, that's interesting.
Pretty much. And now it's just become so convenient, because not only are we working against gravity, more pelvic floor damage, more likely to tear, but we're more likely to have an intervened birth because we're giving our OBs perfect access to our perineum. So we are more likely to see OBs who are sitting in there doing perineal massage over and over and over again as baby's head is crowning. We're seeing them more likely to grab baby and forcibly try to pull baby out by their head, and just like more hands-on birth when it's truly not necessary. Also, when we're pushing flat on our back, we have our coccyx, or our tailbone, that is made to open almost like a pendulum and make more room for baby. If we are flat on our back, it actually keeps our tailbone from being able to open as much as it could for baby. And that's why you hear about people who like break their collar or their tailbone, in birth, because that tip just will break off because it's not able to be as malleable and open for baby like it would be in an upright position.
So sounds like there's going to be less birth trauma on the whole if we started doing having labor in maybe a squatting position.
Honestly, anything that the mother wants. I mean,
Okay.
place to be. And I always say, like, if you want to be squatting, that's great. If you want to be hands and knees, that's great. If you want to stand, shoot, that's great. I would just love if we could see people giving birthing families options instead of just saying, oh, your baby's coming, lay on your back. Even people think that when you have an epidural, you can only birth on your back. That is not true. I've had many clients with epidurals birth on hands and knees, side lying, in kind of a semi-squat position using a squat bar. If you have a little bit of mobility, you have a wide range of options just on the hospital bed. But once again, we're seeing that we are trying to accommodate our providers instead of the other way around. And that's why most people give birth on their backs.
And what would happen now these days in a clinical setting when someone is giving birth and they tell their doctor, hey, I'm feeling like I want to get on my hands and knees and do this? Is there going to be a doctor saying, no, I need you on your back? What's happening?
Yeah, I see that happen a lot. I've actually even heard, I've never had it happen with any of my clients that I've been in a birth at, but I've heard of nurses and OBs literally pushing people onto their back So you're like fighting against people while you're trying to get up, which is horrifying. But most of the time it's just you are very suggestible in labor. It's a natural thing to go really inside yourself and be in a very vulnerable emotional state and just kind of assume that everybody has your best interests at heart. And so when your OB looks at you and says, your baby's coming, lay on your back, you just do it because you're not in the mindset capable of advocating for yourself typically. And so you just do what the doctor tells you to do because you just assume they're the doctor. So even if you did have this huge, wonderful plan of birthing, squatting, or hands and knees, when you have a whole team of people looking at you and telling you to lay down on your back, a lot of times you're just going to do it. And it's really sad.
I follow this pelvic floor health practitioner who really thinks outside the box. Her name is Janelle Peterson in Chicago, and she's got this meme with she's like, the best birthing positions are the same ones you got pregnant using. And they're like booty up, squatting. It was really cute.
We'll get to
Get it in one way, comes out the same way.
Yep.
One thing that you mentioned was about high risk. And I know a lot of women in the bowspring community are having babies later on. They're opening their pelvic floor and they're increasing health in their body. And the originator of bowspring had her first child at 45. Some of my other peers and mentors are having children in their 40s. And I know that in the medical world, that's called a high-risk pregnancy. Would you consider that a high-risk pregnancy? And are you seeing more clients waiting to have birth or having birth in their 40s?
I am. I do actually have a lot of clients 35 or older having their first babies. You would think it'd be a lot of really young people, but no, it's more like 35 to mid 40s I'm seeing. I am not a medical provider, so take everything I say with a grain of salt. But I do not believe that your age is a risk factor. There are parts of being older that can be considered risk factors. You are more likely to have genetic or chromosomal differences, like more likely to have a Down syndrome baby, more likely to have twins. But it really depends on what you consider to be high risk. And it also depends on how healthy of like a 35-year-old or a 45-year-old you are. But I do not think standing alone, just saying age by itself is a high risk factor, though many OBs would argue otherwise.
Let's talk about home birthing. It's for the past few years, it's like my Instagram feed is just showing me a lot of home births, and looks like that's the way to go now. Do you attend more home births and hospital births now?
I would think that I would attend more home births, and I think if I asked myself 2.5, 3 years ago when I was first starting this journey what kind of births I would see myself attending, it would be home births. But probably 85% of my clients have been hospital birthing clients. I have 2 upcoming home births, and those will be my 3rd and 4th home births I've ever attended in about 75 births that I've attended as a doula so far. So very small percentage of my births have been home births. Even though I love home birth, I had a birth center birth with my first, a home birth with my second, and I actually had a home birth turned hospital transfer with my 3rd. So I do love home birth, and I do encourage my clients to look into home birth when they find out they're expecting. But I think the way my personality is and how strongly I believe in advocacy and how bold I am, I attract a lot of hospital birthing clients that way.
Okay. Yes. So one of the posts that on your Instagram I thought was I didn't know a lot about, and I thought was pretty bold, is it was about cervical exams and getting consent for a cervical exam. I looked into it a little bit more, and it said that 95% of them are unnecessary. Can you share with us a little bit about that?
Ooh, that's a tangent I could talk about for hours. So cervical exams in pregnancy, let's just call it what it is, it's unnecessary. Anytime in pregnancy, unless you are experiencing what you think to be preterm labor, and so we have to make sure that you're not actually in preterm labor and dilating. So I'm talking preterm labor is anything before 37 weeks where baby is at risk. of being born prematurely. That is when I could see a cervical exam being a good idea. Besides that, I am hard pressed to find a reason for a cervical exam. Most hospitals will say as soon as you arrive in labor that a cervical exam is required for admission. That is a lie. That is a coercive tactic they use to get you to let them put their fingers inside your vagina and check your cervix. It is not necessary, and that is against your rights, like your human rights as a human being, to be able to say no to someone putting their hand inside your body. In my opinion, and it technically does qualify as sexual assault for someone to perform a cervical exam on you without your consent. In my opinion, anytime a cervical exam is performed without consent, that is any time that someone even walks in the room and says, I'm going to perform a cervical exam. Let's see how dilated you are. That's not asking for consent. That's telling someone what you are going to do. Can you imagine if I walked like any woman anywhere outside of the hospital and was like, I'm going to stick my hand up your vagina right now and feel for your cervix? Like, they would be like, what are you talking about? Like, you can't just go up to people and tell them what you're going to do to their body. For some reason, when women are in labor or birthing people are in labor, we just assume that we have the right to put our hands inside their body whenever we want to fulfill our own curiosity. And that is not true. If we have better trained medical teams, OBs, nurses on how to read real signs of progress in birthing people, we'd be able to know when they're actually progressing without having to do cervical exams. Cervical exams are bogus, in my opinion.
Oh my gosh, that sounds so scary for a mother giving birth to have to stand up for herself in that way, especially when it could cause upset between the person who is going to help her give birth.
Yeah, it is a lot. And that's why at the end of the day, I love being a doula, and doulas can enact great change in the birth space just by being present. But at the end of the day, your doula is only as good as your provider or your practitioner that's overseeing your birth is. Because we can only do so much. If your provider is keen on doing cervical exams every 2 hours, you can deny them every 2 hours, but do you want to have that fight in your birth space? Most people don't. Most people don't want to be arguing with their OB while they're trying to give birth. And that's why it becomes so important to carefully select our birth practitioner, because they're going to be making a lot of decisions. And if they do not believe in collaborative care, if they do not believe in informed consent, if they do not prioritize your comfort and well-being and you feeling safe and heard, then they are not going to be a good person to have on your team.
Out of the multitude of OBGYNs out there, how does someone find one who is cooperative and collaborative with the kind of birth that they want to have? Do you provide recommendations to your clients?
Honestly, I encourage my clients to see midwives unless they are high risk and cannot see an OB. And then we will start talking about how to weed out good OBs from crappy OBs. Not all OBs are evil. I've worked with some really great OBs, but just most OBs in general are just a product of the system. They're trained to fear birth and to look for the worst possible potential outcome and project that onto you. Midwives, as a general rule, have a lot more trust in birth. My favorite midwives in the Indy area are the Community North midwives, if we're talking about hospital setting midwives. Community hospital North midwives across the board, my experiences with them have been hands down incredible. But a lot of times even hospital midwives do fall victim to that mentality of fearing birth, of essentially looking at a birthing parent or mother and thinking prove to me that your vagina and your pelvis work and that your cervix knows how to dilate, because in my mind you're just a walking C-section. That's the vibe I get from a lot of providers, is they're just waiting for you to prove to them that you can't birth your baby, instead of trusting that you can birth your baby and possibly we might have to look into other routes. It's very swapped, that mentality. I've literally had an OB before walk into my client's labor. She was laboring beautifully, progressing well, and the OB was just coming by to check on her. And the OB literally walked in and was like, well, let's see if we can have a vaginal birth today. And it was like, why would you even say that? Why would you even put that little bit of doubt in my client's mind that a vaginal birth isn't a possibility today. It was just, stuff like that is just so crazy to me.
Yeah, that is weird. And I remember at one point I was training to possibly become a physician, and I was shadowing with a bunch of surgeons, and I remember hanging out in the surgeons, they have a hangout room, and they have this thing on the wall where they're like, it's basically they're making their tick marks. They're competing with each other. Whoever gets to do the most surgeries wins, and that's what they want to do. Surgeons want to do surgery. Yeah. They want to do surgery. It's like a competition to them, and they all seem to be a very competitive sort.
Yeah.
I know an obstetrician, gynecologist, they're kind of got their hands in both worlds of medicine and surgery. So
what they essentially do is they train to be a surgeon, and then they move into a brief window of learning about childbirth. It's not like they start out learning about childbirth and like, oh, I'll move into the obstetrics. Like, they go into it with the surgery mindset, and then they do trainings with different avenues of surgery, and then they're like, oh, I like obstetrics. And so it's like, it's not even that they had a passion for childbirth, and there's nothing wrong with that. Like, they became surgeons. The problem is that we are going to see surgeons for low risk pregnancies, and then we're acting shocked when we end up with a surgery at the end of it. It's like, well, you did start off seeing a surgeon for a vaginal birth. Like, what are we expecting is going to happen? Of course, we're going to see surgery skyrocket. And there's an OB that I love that I listen to. His name's Dr. Stu. He does a podcast called Birthing Instincts. And he always talks about, because he is an OB, his experience as an OB, and now he works with midwives in the home birth setting, and how OBs just have a really hard time understanding sitting on their hands. They are taught in school that every time they enter a room, they need to do something. They need to give you a cervical exam. They need to bump up some Pitocin for you. They need to break your water. They need to do something to help things continue to progress, because that's what they're taught. You always should be doing something. Whereas most midwives are taught, in the absence of special circumstances, you sit on your hands, right? You just unfold. And so, it's a bad example, but you think about your dog being in labor. I wouldn't say, oh, your dog's in labor. Oh, go bring her to the vet. They'll put her in a kennel in the back room and have her labor there. They'll take her blood frequently. They'll have a blood pressure cuff on her. They'll take her temperature and make sure everything's going.
Give her a cervical exam.
Yeah, I can see how dilated your dog's cervix is. No, if you call your vet and say my dog's in labor, they're going to say, okay, keep an eye on her, but let her be in a quiet, private place. Leave her alone for the most part. Make sure she has access to food and water, and clean blankets. And they would mostly tell you to leave her alone. And it's kind of sad that we are more humane with our animals in labor than we are with our humans when they're in labor. So, yeah, you know that a dog would not have a labor that progresses at a vet's office with strange smells, sounds, and things that they're not familiar with.
It makes sense that it would be easier at a familiar place where somebody feels comfortable. I want to touch on painless birthing and hypnobirthing. It reminds me of something I've been reading about. There's a midwife named Ina May Gaskins, and I've been looking through her book, and she's got pictures of orgasmic birth. Have you witnessed this before, and is it possible?
I have had one client who said that she would call her birth orgasmic, which is awesome. I think you find what you seek. So a lot of people, when they hear painless birthing, they scoff and they say that, it's a lie and that we're doing damage by telling people that they can have painless births. And I think it's quite the opposite. I think when we tell people to expect pain and that birth is going to be the most excruciating experience of your life, more excruciating than breaking a leg or things like that, then of course you're going to walk into that process expecting pain, and every sensation you feel, you're going to tell yourself, oh, that's the pain they were talking about. And I hate the narrative behind pain and birth. I think it's a very misogynistic mindset. I think it's misogyny that leads all the way back to that Bible verse that was mistranslated that said that the curse of Eve was to have pain in birth, and it's just men telling us what we should feel and mansplaining birth to us, in my opinion. um you know, you think about sex, for example. You know, a few hundred years ago, women were told all the time, sex is just painful, sex isn't enjoyable for women, it's not meant to be, so just like suck it up and let the man have his time and bear us children. I very much view birth as being kind of that way. I think in a few hundred years we're going to look back and be like, I cannot believe that birth was taught as something painful.
Yeah, they used to tell us it was like they've conditioned it to being painful. Everything that we've seen about birth on TV is like, oh my gosh, it's so huge. They're screaming, they're cursing. That's what we see, so that's what we do.
Yep. And in reality, birth is sensation. Your body, I always say, like, your body is working really hard, right? Anyone who's ever done any sort of hard workouts with their body, yoga, strength training, running, they know that your body, when muscles are working how they should, it strains. You feel burning sometimes, you breathe hard, you sweat. But you would never say like running is excruciating. You say running takes practice, running takes energy, it takes determination. But it's sensations. It's burning in your legs. It's your feet hitting the pavement. Birth is just sensations. I personally would never call my first two births painful. My third one's a different story that we don't have to get into today, of course, but birth can be painful. I'm not saying that people are not valid in their perception of painful births, but what creates pain in labor is actually our muscle groups working against each other. We have two muscle groups in our uterus, one that are round muscles that go up the uterus like this, and they get the thickest at the bottom third where our cervix is, and then the other muscle group are long muscles that go down the uterus like this, and they get the thickest at the top third where our fundus is, where if you like touch the top of your belly, you feel that little harder spot. And what happens is the long muscles pull, and then the round muscles open in response where our cervix is. So it's just a pulling up of our uterus like this, and a tightening of the uterus, and then our cervix just opens in response and peels back, essentially. But what happens is our cervix is a sphincter, and our sphincters are connected to our nervous system. When we are feeling anxious or upset or afraid, our sphincters don't want to open. Our cervix works the same as any other sphincter. And so what's happening is those long muscles are pulling at a cervix that doesn't want to budge. And so, of course, having two muscle groups pulling against each other is going to be excruciating. And so we do create our own pain, essentially, by not having safe spaces where we're giving birth in, and not learning proper techniques of relaxation, of deep breathing, of surrendering to the birth process. But ultimately, if we can let our muscle groups function how they're supposed to, feel intense sensations of pressure, of tightening, of opening in labor, you will not have a feeling-free birth or sensation-free birth, but pain-free birth or painless birth is very possible. Now, there are things that I do like to highlight, that like pain is a form of communication to our body. So like anytime you have pain in your body, it's your body saying like either you're missing a certain ingredient, like you need more potassium or magnesium, or it's your body saying like you injured yourself. So in cases where there are pain in labor, most of the time it's communication. You'll feel pain in your back if your baby's malpositioned in like a posterior position. You'll have back labor, which is back pain, which is a real feeling and a real thing. Or when baby is crowning and you feel a stinging and a pain at your perineum, it's your body saying, whoop, you might tear if you continue to push right through this. And so that's when your body's saying, slow down a minute, breathe through this one, let your body stretch. And so I feel like we do our women a huge disservice by saying birth across the board is pain, because then we take away our body's communication with our body.
Yes.
Us anymore, because we're just experiencing everything as pain. And it takes away the joy that birth can be, the high that birth can be. I feel like if women could truly experience birth how it was meant to be, we would be uncontrollable. Like women would not be the same, because you reach such a high level of empowerment, of strength, of like love for your body and yourself and your ability. And if we keep on telling women that one of the most important things that we can do in our life is one of the most horrible things to do, then we will continue to be very easily controlled, and we will continue to hate our bodies and hate what our bodies do, from our periods to our boobs growing to us birthing babies and beyond, because we are hating such a huge part of ourselves. So
that makes so much sense. Something that came up for me is, I want to know, do you think we have conscious control over the smooth muscles of the uterus? I know that in the past they've said we do not have conscious control over certain organs, but in the yogic world I've totally seen it happening. I can actually lower my heart rate with focused meditation. Do you believe that one can actually soften and release the cervix consciously?
So I do, because we like to say mind and body. I'm sure you're of the same mindset. Mind, body is what it is, not mind and body. And so if we are in a safe space, emotionally, mentally, and physically, our body's allowed to function how it's supposed to. We teach this very heavily in hypnobirthing, that, you know, we call it the emergency room, which is our fight, flight, freeze, fawn mentality. And when we're in that space of being afraid, our entire body is going to be tense. Our oxygen is redirected to defense muscles, and like our heart and lungs. Our uterus needs blood to be able to be open enough to function properly and to birth our baby. And when we're in that fight, flight, freeze, or fawn, that blood is redirected elsewhere. So our muscles are naturally going to tense. In hypnobirthing, we teach the very mindful relaxation, breathing techniques, and visualization. And we talk a lot about imagining our birthing muscles to be as smooth and supple and soft as like blue satin ribbons, or like a flower opening. So yes, I do believe that our mind does have some control over how our body is, but most of it is just a lot of learning how to relax as a whole and birthing in an environment that allows us to feel like we can relax. Deep down, like I mentioned, we're all mammals. We're created that if we feel unsafe in any form, we will not bring our babies into an unsafe environment. If you stumble upon a deer in the forest, she's going to stop her labor so she can take off and go birth somewhere else. The problem is that we are walking into birthing environments that immediately set off our red flags. Fluorescent lighting, a huge one we see in all birth spaces in all hospitals typically. Fluorescent lighting was created to actually trigger our fight, flight, freeze response, because it keeps you awake. So it's used in offices to keep people awake so they can do their jobs. But we use it in all birth spaces. Bright fluorescent lighting as soon as you walk into the hospital. There's beeping. There's the smell of the hospital that immediately turns you off most times. There's strangers coming in, checking your cervix, sticking their fingers up your vagina. A total stranger. And this is like accepted. Then we have people doing blood pressure, temperature, drawing blood, sticking you with an IV, asking you a multitude of questions like how many stairs are in your house. And all of that pulls you out of that intuitive, instinctive space that you want to be in birth, where you will feel relaxed and open to what is happening in your body. So it's going to create tension and it's going to create fear. And your body can't tell the difference between a real threat or a perceived threat. And so it's going to treat them all the same. And so we are just birthing in such an opposite way from what our bodies crave, that makes it so our bodies cannot fully open and release many times.
Wow, so a lot of good information here. I know that you said you had to go soon, so I want to wrap this up. You've shared with us so much information. Thank you so much.
Yeah.
How can people get a hold of you? I guess, obviously, if you're on Instagram now, you can just click on her profile. But for those of us who are watching later on my YouTube channel, can you share with us your website?
Yes, so my website is very simple. It's heartandwomb.com. So heart, like in your body, like your heart that beats, and spelled out A-N-D, womb, W-O-M-B.com. And also, if you want to check me out on Instagram, it's heartandwomb.indie, or at heartandwomb.indie, I guess is what it is. So you can check me out there. Feel free to DM me or send me a request via my website. I'm always open to asking questions and chatting more about birth.
Thank you so much. And I want to encourage anybody to leave any questions in the comments for me or Brianna. Thank you so much for speaking with us today.
Yeah, thanks so much for having me. It was a pleasure to talk with you.
Great. All right. I'll see you later.
Bye.
Bye.